Dr. Richard Krasuski from Duke University, and today we're going to talk about implementing aggressive monitoring and sequential combination therapy. What is the rationale for this? So on this slide you can see an example of aggressive monitoring and escalation of therapy. This is a patient who's come in who has function class 2 symptoms. You start them on initial monotherapy and then you wait for potential decline in their clinical status or some other evidence that they're failing medical therapy. When that occurs, you add on a second agent and again, potentially a third agent. Again, sequential add-on or switch strategies may buy you time, but they don't always push our patients to goals. So let's talk about why we're targeting therapies, why we're adding these agents on. So targeting multiple pathologic pathways improves response. Again, combination agents are working on a variety of pathways. On the left you can see is the prostacyclin pathway, which you know has derangements in it in patients with pulmonary arterial hypertension. In the middle you can see the nitric oxide production, which is clearly impacted in patients with pulmonary arterial hypertension. We now have different ways of approaching this particular pathway with multiple agents. Again, these two agents should not be used in combination, but we do have different ways of targeting them. And then finally, the endothelin pathway, where we can also affect and reduce the effects of endothelin on the vasculature. So let's talk a little bit about the studies with the data that supports this strategy. So we'll start with the PACES trial. So in the PACES trial, we looked at folks who were on baseline epoprostenol and looked at the addition of sildenafil. So on the slide on the left, you can see 6-minute walk change over time. And you can see when they were on placebo, there was essentially no change compared to baseline, where there was a statistically significant improvement in the patients who got sildenafil. On the right, you can see looking at clinical events and clinical worsening, and you can see the patients who were started on sildenafil versus placebo had a statistically significant reduction in clinical events. Next is the first trial. In the first trial, we looked at the addition of tadalafil to baseline bosentan. And this is again looking at a change in 6-minute walk distance. And you can see over time, there's a clear separation between the curves and those patients getting 40 milligrams of tadalafil versus those patients who are treated with placebo. The next trial is the Seraphin trial. So in the Seraphin trial, we're looking here at the patients who were treated on baseline therapy, who got macitentan added onto baseline PDE5 inhibitor, and you can see clearly an improvement in the patients compared to those that remained on placebo. And finally, the Griffin study, the folks who are on baseline therapy, and you can see the event rate, and that's the curve on the bottom, and then you look at when selexipag was added, comparatively, the statistically significant difference that was seen. You see about a 37% reduction in clinical events by the addition of selexipag to those that were on baseline therapy. So in what type of patients would you consider a sequential combination type strategy? First of all, low to moderate risk patients. Again, those are unlikely to deteriorate rapidly. You should be very careful to assess these patients early in their treatment course, ideally in the 1 to 3 month range. You really don't want to stretch out that follow-up appointment too long. If the patients aren't clearly moving towards a low-risk category, you should consider escalation of care with a second or third agent. So in summary, we've talked about the data behind the aggressive observation and add-on therapy strategy, which is reasonable. It is important to watch these patients very carefully and add on drugs if necessary, and certainly the clinical outcomes appear to be improved compared to just keeping them on monotherapy. And I thank you for your attention.